But if it's just a general loosening up, you know, you had a hard day and you feel like you need to have a little massage going on, a good pattern is we work the crest right here as we come off, because right in here there's a muscle that attaches right here at the crest and goes right up to the ribs. So it's from here to here. It's called the quadratus lumborum because it's a low back, that's the lumbar area, and it looks like a quadrant. So this area right here can get very, very tight and very, very tense and harbors a lot of trigger points. Trigger points are very dense focal points that can create a pain pattern in a patient or a discomfort pattern in a patient that is experienced somewhere else. For example, I can have a trigger point in the lower stomach muscles and I can feel it like a pain band back here. So that's, you know, something that the pain is not necessarily coming from here, right? In that instance, there is a possibility it comes from the lower stomach wall. If I do some trigger points in there, it can release that sometimes. We're not going to go to the stomach right now because it gets a little bit more dicey, but that's an example. Another example is people with very tight trapezius. Trapezius is a muscle that goes from all the way up here to all the way down here, more or less, T12, and then it goes out to the side and attaches on the shoulder, on the clavicle, the collarbone, as well a little bit on the part of the scapula, and it can create pain pattern, especially the upper one, that is a pain in the neck, and I mean a headache that's like this. It looks like horns. The patterns look like horns on the ram, for example, the way it goes. And so when that pain pattern shows up, I can work this muscle here and the headaches can go away. I can also squeeze that muscle and it can intensify the headaches for a moment a little bit until the body starts releasing it. So trigger points are points that are focal, dense spots in the muscle that can't let go and cause pain somewhere else. They're thought to be in the muscle fibers that tell the nervous system of how tight the muscle needs to be. So there's a thought that if we release a trigger point, the whole muscle can relax more. How do I release a trigger point? And yet, besides the whole muscle relaxing more, we want to, of course, get rid of the pain pattern. So that's what we can do with that too. How do I find a trigger point and then how do I work it is the next question. Working the trigger point is easy. Essentially what I want to do physiologically, I want to squeeze all the blood out of the muscle. Then the muscle doesn't have energy. Therefore the muscle cannot relax. Therefore the muscle the muscle cannot contract, and therefore the muscle has to relax. It's a very simple concept. Doing it is a little harsher. So let's first look at this area right here is where I work first as a more pétrissage or as a more focal work. I don't do broad strokes. I'm a little bit more pointy. I'm going across the muscle that I want to work. Right here is the crest. And I find a few points that feel denser than other points. Okay? When I find a point that's a little denser, I got one right here. What I can do is I can slowly hang out there. I slow everything down. I feel the muscle. Then I go with his breath. When I go with his breath and he exhales, I can go a little bit deeper in that muscle. When he inhales, I don't let go. I stay down. Then the next breath going out, I can go a little bit deeper with that muscle. That way I assure I'm going slow, with his comfort, and I'm not just going bam, going in, and the muscle goes, hell no, and it's fighting me. We don't want the muscle fighting because I don't want to exert more energy than I have to, plus it's not going to help him. Right? So we can do that. So I do the crest, I go along the crest, and then after that I can go up the spine and I go back to these cables. And now what I do is often the double thumb. I feel, and I'm right on the cable, and I go up the spine, and I feel the cable. I can go across the cable. I have to be careful I'm not jumping it. Jumping the cable is this. Look at the back, right by my thumb. That's jumping the cable. We don't want to do that. That can hurt because I can push in on the other side of the cable, not realizing how much force I got, and out. And so therefore, at that point, it's harder for the muscle to relax. When you get better at it, you can put pressure on the cable, and you feel it relax. If you feel it slipping away, and you just got to put a little pressure on the other side, gently and slowly. That was a little bit jumpy. And then when you still can't hold and you go off, you just learn that you'll just back off immediately. Okay? So I go up the spine, And again, of course, this is the area we figured out there's a lot of pain, there's a lot of tension. Well, that's probably going to be where we find trigger points, most likely. So I find some points right in here, and I'm finding them. Right there's a big one, and I can then go with his breath, go a little deeper, each breath, and then I can check in with Rob and say, hey Rob, you feel that?
Mm-hmm.
Does that feel like it's a focal point?
Yeah.
How does it feel? Is it like burning?
It can go a little harder.
But it feels burning, the sensation?
Yeah.
So I want you to tell me how deep I can go, and I want to scale from 1 to 5.
Okay.
1 is this.
Right.
5 is get the hell out of there.
Right.
I want it fairly deep, but I want your muscle, and that's more important, I want your muscle still be able to relax and not fight me. It's about there.
A little more. Right about there.
And then I can also go in with my breath if I'm not secure, if it feels like, wait a minute, I'm pressing way too hard. I can go in with this breath, I can be very slow and very gentle that way. I can still go extremely deep. And then I ask him, I put the pressure on, I ask him, I say, Rob, is this getting a little bit easier?
Yeah.
Good, then you can go a little deeper. As you get better, you just feel it. The muscle greases up a little bit, you find the same resistance, and you push in more. Okay? And then I often just go all the way up the spine, and then of course I do also on top, I also go out a little bit. And I make sure I go out a little bit, and I work this muscle too. Okay? So that way you work the trapezius, you work all the paravertebral muscles, and you work the quadratus lumborum real well. And you do work the underneath muscles as well, it's just those are the most superficial.